Beautiful day we're having in New Mexico this time of the year. Actually get some a lot of flowers on the plains now, but anyways, let me stay focused. This video is about colds and allergies and other respiratory sorts of ailments. And so another reason, common reason, why you might be getting a steam generator. And by the way, Mary, thank you for this question on the call yesterday. It's a great one because, again, a lot of people are in this situation, have different types of respiratory ailments. A lot of people, by the way, move out to New Mexico and Arizona for allergy reasons, because that climate is sometimes a lot better for them. It's a little bit drier. So that brings us to the topic of, and I'm the only one, I believe, that actually really talks about this in this steam therapy category or industry, which is drier steam versus wetter steam. And so fill out that questionnaire if you have any sort of respiratory ailments, because the bottom line is this: some types of conditions people respond much better to, or do better with, more comfortable, have better relief of symptoms with a drier steam, and just the opposite, sometimes do much better with a wetter steam. And this also factors in with where you're living. Okay, so living in southern Florida is very different than living in New Mexico, and it's also very different than living in Alaska. So I help people all over the place, and so we also have to kind of focus on that as well. And I ask, and there's a lot of detailed questions. So when you fill out a questionnaire, just fill in as much information as you can. Tell me, do you like to run the heat a lot in the cooler months all the time? If you run a lot of heat in the cooler months, in general, there's going to be very little moisture in your home. And then I recommend using a humidifier, or if you do your steam therapy every day, you're going to be better suited to having a wetter steam. Anyways, so like COPD, that I have some people doing it for, they're generally a little bit better with a lower set temperature and a little bit of a drier steam. Okay, makes it a little bit easier to breathe. If you have asthmatic conditions, I talk about that on the page based on respiratory asthmatic conditions, and allergies. If you live in an area and you can't move and you're always suffering during certain parts of the season, again, just based on kind of what you fill out there, please mention exactly what you're allergic to. If you have, cats in your house that you're allergic to, I've helped people in that situation. You can actually get some relief, again, from steam therapy. And it's going to, depending on your type of allergic response to some things, and again, the type of symptoms that you're experiencing, it will depend if you want more of a wetter or drier steam, or a much hotter temperature you want to set it at for your sessions, or much cooler, or the coolest temperature you can set it at. And also, what greatly helps for some types of conditions, respiratory conditions, is a type of hydrotherapy related to cold and hot alternations. So again, like a COPD type of condition, asthmatic type of condition, where some people have a lot of mucus in the lungs, or the part of the lymphatic system in the chest really needs to move a lot of stuff. Some of the best things to do is use a very hot, dry steam temperature for a few minutes, and then while you're in your shower, then just turn on a freezing cold, or as cold as you can handle it, shower, and just have that hit your chest or hit your back on your lungs, basically, and just keep your hands up a little bit to take some stress off of your lungs, or some pressure from weighting down on your chest, and just allow that to hit your chest for 2 minutes, very cold temperature. Then shut it off, warm yourself back up again, as long as it takes. Could take like 8 minutes, 5 to 8 minutes, to feel like you're kind of hot again. Go back in the cold again. So there's some additional kind of protocols and techniques, and that's an old hydrotherapy. Hot cold has been utilized for a long, long time, going back a couple thousand years, and that's an extremely effective way for stimulating not just the lymphatic system for respiratory, but actually helps in general greatly. And there's a lot of studies out there, by the way, for the lymphatic system, and especially if you're using this area, because right here is where you find your thymus gland, and of course your thyroid gland is here as well. And these are master glands. They all play a million or myriad of roles with immune system function. So these get greatly stimulated by the hot-cold alternation. So if you're going to do the hot-cold for respiratory or just immune system, again, it's a very, very hot, dry steam alternated with freezing water. And you'll find that over time you're able to handle colder and colder water. And one of the signs that you'll notice if you're shifting a lot of stuff in here and with circulation and with lymphatic system is at some point in this alternation you'll feel like you're able to take a deep breath. You'll just notice it. It's like something you can actually feel like there's a weight off your chest that has shifted and moved. And it just feels good, and after that session you just feel like you're breathing easier. And you're able actually to get more oxygen at that point. That's when you'll know if you're doing it right. It may not happen your first session. It could happen a few sessions. Everybody's different. But at some point you will notice that. Anyways, if you have any more questions, please fill out the questionnaire, send me an email, and be happy to